Today I am going to talk about the physical examination of the child in the pediatric nursing. Physical examination is important tools to assess the health status of the child's body, and through this we will get the objective data to identify the child's problem, and it will also help to make a diagnosis of the baby. And you should know why we are examining the child, because through this we are assessing or examining the child in physical aspect. We will collect correct or valid information regarding the child's health, and to identify the child's problem, and through this we will go the some ideas regarding the nursing care for the child's problem. And we know that you can see here there are some methods for the physical examinations like inspections, palpations, percussions, and auscultations. And there are many more methods to assess the physical examination, but we are talking about only 4 methods here. In inspections, through our eyes we can assess the child's postures, size, shape of the baby, and color of the child. And next, through the palpation we can touch or palpate the child's lymph nodes, and check the temperature with the help of touching by the superficial. Next method is percussion. We can tap or strike the child's body for hearing some sounds, or we can feel the vibrations activity from the organs or of the body. And next is with the help of the stethoscope we can auscult or listen the body sound, and through this we can auscult the heart rate from this tool. So these are the 4 methods which will help us to identify the physical abnormalities or health status of a child or a baby. So now we are moving to know that what do we have to check from the head to toe while doing in physical examination. So this is a tabulations format for the physical examination, and here you can see in the left side some physical features which will help us in physical examination, and other right hand side according to the physical features we will assess, and here we will write the actual child's conditions in this column. So first physical features is general appearance. In the general appearance we can check in the child's level of conscious, postures, grooming, body build, gait, and activities. First, in the physical examination of the general appearance, first point is level of consciousness. We will check the child's consciousness level. For example, whether baby is conscious, semi-conscious, or unconscious. According to that, we will write in the right side in the child's pictures whether baby is conscious, semi-conscious, or unconscious. We can write here, but we should know about the how we will check the consciousness level of the child. We will check the consciousness level by the Glasgow Coma scale, right? Next is posture in the general appearance. In this we will assess the postures is a normal or abnormal. Abnormal, for example, kyphosis is an example for the postures. If baby have an problem with the kyphosis means abnormal curved supine. In this baby is growing with the abnormal curved supine, right? Next is grooming. Well groomed or dirty we can assess in the child. Next is body build. In this we can assess three signs. For example, endomorphic, mesomorphic, and ectomorphic. And here endomorphic body shape like an apple, which means more fat body we can see in the baby. And mesomorphic means like a athletic look like structures or a body of the baby. And ectomorphic body means the pear shaped body structure of the baby. And next general appearance is gait. We will assess whether the child is standing upright positions or not. And next is in activity. We assess the activities of the child whether is active or dull in nature. Next physical features is vital sign. In the vital or cardinal sign, we will measure the child's temperature, pulse, respiration, and blood pressure also, and write in the right side column, right side of the child in the child's pictures whether it is normal or abnormal. But yes, we should know the normal value of all, and only then we will find out the abnormalities in the child's conditions. Next physical features is skin. In this, we will check the skin's temperature whether it is a normal or whether it is a warm, cold, or clammy. Like that, we can write in the right side in the child's picture. And also check the color of the skin. For example, baby skin color may be paler or yellowish color, and cyanosy or pinkish maybe. And check the textures of the skin. For example, sometimes a baby's skin texture is smooth, sometimes wrinkle, or sometimes hydrated or edematic. Like that, we can write in the right side in the child's picture. And check the any lesions on the skins. For example, if there is no lesion, then we can write here no any lesions present on the skin. Maybe vesicles present, then we can write the vesicles present on the skin. If sometimes papule present, or maybe sometimes ulcer may be present, then we can write in the right side. Then next is check the skin sensations like normal, anesthesia sensations, or any other sensation we can check and we can write here. Next is physical features, are head and scalp. First we will check the head circumference whether it is normal, hydrocephalus, microcephalus, and macrocephalus may be present, and then we can write here. Next we will check the scalp lesions, their cleanliness, any infections, any psoriasis, or maybe any other conditions we can write here. Next, check the anterior or posterior fontanelle if it is closed or not. Next, assess the shape or size of the child's skull. And next physical features is hair. In this, we will assess the hair textures like normal, dry hair, hair oily, thin, or alopecia, and also assess the color of the hair, and also check any dandruff, pediculosis present or not. Then we can write here according to the condition of the patient. In the face, we will recognize the child's face to assess any sadness on his face or not, and also assess the face color of the child. Next feature is eyes. In eyebrows, we check the symmetrical and asymmetrical conditions of the child, and in eyelashes or eyelids, we can check any kind of infections or infections is present or not. In eyeballs, we check any abnormalities like any protruded or sunken eyes problem we can see here, and we can write here also. Next, in conjunctiva, in this we check the moist, pale, any watery, and any other abnormalities we can check here. And next is in sclera, and check any redness or any infections in the sclera, and we can write here. Next is lens. Check the lens transparency with the help of the tools of the eye. And next is pupils. Check the dilations and any constrictions, and we can assess reactions to the light also. If there any problem occur, then we can write in the right side in the child's picture. If it is normal, then we can also write there is no discharge, there is no problem, it is normal, we can write like that. Next is visual power. Check any abnormalities like any blur vision, and with this we can also check the eye movement for the strabismus. Strabismus means bhangapan, and any eye discharge and present or not we can write according to the eyes conditions. Next physical features is here any ear discharge present or not, we can write. And in tympanic membrane, to check any perforation, any bulging or any other problem with in the ear, we can check and we can write here. If there is no discharge, if it is normal, then we can write here there is no discharge, there is no infection, and there is any no kind of any infections, then we can write in the child's picture it is normal for the particular features. And to check any hearing abnormality present or not. Next feature is nose crust, means any discharge present or not from the nasal cavity, then we can write. And to check any deviations or perforations on the nasal septum part for the of the nose. According to that, if any deviations or perforations present, then we can write in the nasal septum some deviations or maybe some perforations will present. According to that, we can write in the child's pictures in the right column. And in mucous membrane, we can check any swelling or epistasis, and any other condition if we are saying, then we can write here. Next is polyps. Polyps is like a abnormal growth of the tissues on the mucous membrane. So here we will check the polyps present or not. Is there any abnormality present or not? Any abnormal growth of the tissues present or not? Then we can write here. Next is sinus, and this to check any sinus infections present or not. Next feature is mouth and breath, check any kind of smell coming or not. Halitosis may be present, then according to that we can write. If some breathing smell will come, then we can write some halitosis may be present. Next, to check any congestions in the throat, is it is present or not. Next, to check any infections in the tonsils, maybe tonsillitis may be present, then we can write in the child's conditions, maybe in the mouth tonsillitis present. In the same line, first we will check the what features we are checking, like in tonsils we are checking, then same according to that we can write the tonsillitis is present, right? And teeth, we can check for this, like healthy shiny teeth present or not, any dental caries, any plaque present or not, then we can write. In tongue, we can check the color, any moisture, dryness, or maybe present any sign of glossitis, we can check here and then we can write. And next, to check the lips. Lips problems like any redness, swelling, cyanosis, or any others problem, we can assess and we can write. And in mucus and gums, we can check any ulcer, gingivitis, bleeding gums, and any other pus formation if present, then we can assess or we can write. Next features is neck. In neck, we can check any tenderness, any abnormalities, growth on the lymph nodes, thyroid glands, abnormalities, flexions or extension, we can check also. Next physical feature is chest. In the chest, we can check the thorax, breath sound, breast, nipple, heartbeat, heart sound. And in the thorax, we can assess the symmetrical or asymmetrical or any other abnormal shape, we can check in the thorax. And next is we can check any wheezing or grunting breath sound from the childs, we can also assess here and we can write abnormality. And check any abnormality sign in the breast, like the mastitis or any other lymph abnormal may be present or not. And next, we can check the any cracked or secretions from the nipple side, we can assess and we can write here. If any abnormality, if it is normal, then we can write there is no any abnormality in the nipple side, right? Next is we will check the rate, rhythm, and volume for the heartbeat for the child. And next is a skull, the abnormal heart sound like murmur sound may be present sometimes or maybe sometimes not present, then according to that condition we can write here. Next physical features is axilla. In axilla we can palpate the lymph node and also check the tenderness in the child. Next feature is abdomen. There are four methods for checking the abdomen in the child. In inspections we can see any skin rashes, hernia, ascites, distensions on the child's abdomen we can check and we can write here in the inspections. Next is palpation. In the palpation we can palpate on the abdomen and check any tenderness. If it is present, then we can write here through this palpation we can feel any tenderness on the patient's abdomen. Next, percussion. Through the percussion we can check the presence of the gas, and if gas present, then child patient will feel the dull. And next is auscultation. Through the auscultation we can check the bowel sound is present or not. Next feature is genital organs. Genitals organs, it is divided into two parts according to the male baby and according to the female child. First we will discuss in female. In female we will check the mons pubis, external genital organs, and urinary pattern, congenital anomalies. Mons pubis is normal in size or not. We will first we will assess and then write in the child's pictures any infections, edema, and any other problem with the external genital. If we will found, then we will write any burning, micturations present or not. For the urinary patterns we can assess, and to check any congenital anomalies present or not, then we can write according to the conditions in the female baby. And then next is in male child. Mons pubis is normal in size or any other lies present or not. We can examine in the mons pubis. If it is any abnormality we will found, then we can write in the mons pubis abnormalities. And to check any urinary abnormalities like epispadiasis or hypospadiasis or any other problems present or not, we can write here according to that urinary abnormalities. And next, to check the descended or undescended testes for the scrotum. And next is inguinal canal is normal or not, and this we can also assess the hernia whether it is present or not. Next, to check any congenital anomalies present or not in the male child. If it is present, then we can write in this side. And the last physical features are rectum and anus. To check the rectum and anus part for any congenital anomalies whether it is present or not, and any other medical problems like piles, polyps, melena, ulcer, rashes, etc. may be present or not. If it is present, then we will mark here in the child's picture. If it is normal, then we can write as a normal. So this is all about the physical examination of the child. So if you have any doubt, then drop your message in comment box, then I will clear that. And thank you for watching this audio visual lecture. Thank you.